Hi guys, this is a bit more like it, isn't it? So, big change in the weather recently, certainly over the weekend, and I'm hoping that's going to improve your levels of motivation and enthusiasm to perhaps get outside and get active. One thing I have noticed recently with a lot of the folks that we're working with at Healthy Options is there has been a definite dip in levels of motivation and enthusiasm towards getting outside and getting active. And I think that's quite natural to happen at this time of year, especially as we had a period of pretty bad weather, very cold weather, which brings other risks associated with slippy ice um, and breathing difficulties for many folks. So hopefully we've turned a corner, um, not just in terms of vaccines and our, as Boris says, our roadmap out of this thing, but also with the weather as well. And I do hope that that will start to ease perhaps a little bit of the lockdown fatigue, which we're undoubtedly all suffering with. So um, I just thought it's quite an apt time really to maybe stop and think about how you want to feel and how you want your health to be in a couple of months' time as we start to ease out of lockdown. Let's hope everything goes to plan and that remains on course. But certainly by end of April and into May, it does look like we're going to see some significant changes. So we have a period now we can really start to work towards improving our health and fitness. So when that time comes around, we're in a much better position to enjoy our newfound freedom. And really, I think a lot of this is about taking responsibility for our own health. It's important that we get outside, we get active, obviously adhere to current guidelines and future guidelines. But as well as adhering to guidelines, there's a lot we can do to improve our own health and help ourselves and really practice some self care. Um, because we've had a period where obviously the NHS has been under huge pressure, and I'm sure we've all seen the documentaries and the news reports, and what our NHS workers, especially in our emergency departments, have been going through is quite horrific. Um, and the acts of gratitude that we've shown, things like the clap for carers and the clap for the NHS, and we're seeing rainbows everywhere thanking the NHS are fantastic gestures. But I guess if you were to ask most NHS staff what we could do to improve things going forward, it would be that we take a bit more responsibility, not just in terms of adhering to government guidelines, but responsibility for our own health. Because although we passed that horrible milestone of 100,000 COVID-related deaths some time ago, um, NHS data tends to show that there are somewhere around 400,000 obesity attributable deaths every year in the UK. That's quite a sobering thought. And obviously, that isn't going to change anytime soon. So, even if we do kick this disease into the long grass and we manage to control it a lot better going forward, we're still going to have all of those obesity attributable deaths. And that's somewhere where we can really make a difference ourselves by taking responsibility for our own health, looking at our diet, looking at our activity rate, and by doing that, we significantly reduce our individual risk of developing significantly bad health conditions going forward. And if we can all do that, as we've all tried to adhere to guidelines as best we can, then going forward we can also reduce the risk, not just to ourselves, but to the NHS becoming overwhelmed. Because remember, before we went into this pandemic, the NHS was already in quite a vulnerable condition in terms of how well it could look after people. We're very, very good in this country at looking after people acutely when they have significant issues. Our accident emergency departments are second to none. But a lot of you may have suffered long waiting times for certain procedures or known people that were struggling with long waiting times, and obviously that's something that is only going to get worse as we come out of this pandemic, and therefore it's even more important that we really try to look after ourselves and reduce our own risk and reduce the pressure on an NHS that's going to be quite fatigued come the middle part of this year and well in need of a rest. So do what you can, get outside, make use of this incredible weather, and treat yourself well. So look for things you can do in terms of self-care, whether that be walking on a regular basis, reigniting an old hobby which is active, maybe getting the bike out. Not so long to go, we might get some nice calm seas like we have today, get the kayak out, whatever it is that rubs your rhubarb, get out there, get active, and let's try and reduce the risk that we all face. I will catch up with you next week, guys. Hopefully I'll come back to you next week with another day like this without a cloud in the sky. Birds are singing, spring is here. We are on the way out. Take care. Bye-bye.